Testing for pregnancy. A pregnancy test is a quick and reasonably accurate test to show if you are pregnant or not. The test is usually done using a urine sample and can be performed either at home or in a health clinic. As soon as a woman becomes pregnant, her body starts producing an increased amount of a hormone called human chorionic gonadotropin, or the HCG. Pregnancy tests detect the presence of HCG in either the urine or the blood. In the early stages of pregnancy, the production of human chorionic gonadotropin increases sharply. Testing for this hormone is used to determine pregnancy. The urine test involves either peeing onto a test strip, dipping the test strip into a small sample of urine, or using a small pipette to drop urine onto the strip. In each case, there is a small chemical reaction if HCG is present, and the strip will show this either by a color change, a line appearing on the strip, or by indicating it digitally. Some newer tests can even tell you how many weeks pregnant you are. The urine pregnancy test can show whether you are pregnant as soon as you have missed your period. This will be about 2 weeks after you actually conceived. However, there are some very sensitive tests that can be used as early as 6 days before a period is due. What the results mean. If the pregnancy test is positive, it usually means that you are pregnant. Rarely, however, the test can be positive although you are not pregnant. This might occur if the test is done soon after you have given birth or had a miscarriage, or if you are taking certain medications. Likewise, the test can occasionally be negative although you are actually pregnant. This might occur if the test is done too early or the particular test kit is not very sensitive. If you think you are pregnant and the test is negative, it is a good idea to repeat the test about a week later or ask your doctor for an HCG test, which is even more accurate. When your pregnancy test is positive, you should arrange to see your doctor for prenatal care. You should also discuss whether you should be taking any vitamins such as folic acid. However, if you have abdominal pain or bleeding, then you should see your doctor immediately, as this may indicate a medical emergency. Home pregnancy tests are readily available from pharmacies and supermarkets in many countries. They use a sample of your urine to detect HCG, but they may vary, so always follow the instructions. Results are available in a few minutes. The convenience of the test means it can be used as soon as you have missed your period. Some are sensitive enough to be done 6 days before your period is due, but none is 100% accurate. Tests may be more accurate if an early morning sample is used, especially in very early pregnancy. Thank you for your attention.
Let's now go to pathology of Qi mechanism. Let's discuss entering or exiting of Qi in space between skin and muscles. The space between the skin and muscles is one of the triple burner cavities called coli. We translate the term coli as spaces and texture. Thus, although we usually translate the term coli as the space between skin and muscles, strictly speaking, such a space is only one of the coli spaces. Here we can see the figure, the space between the skin and the muscles. The skin, the lungs, and then the space between the muscles is the coli, and the muscles is the spleen. Next, the space between the skin and muscles is an energetic layer corresponding to the surface of the body, also called the exterior of the body. In pathology, excessive exiting of qi in the space between the skin and muscles implies excess yang movement. This will make the space between the skin and muscles too tight. Sweating is reduced, and if the patient is invaded by an external pathogenic factor, he or she will develop a high fever. Excessive entering of qi in the space between the skin and muscles implies excess of yin movement. This will make the space between the skin and muscles too relaxed. Defensive qi does not circulate well, the pores are too open, and the patient will be prone to invasions of pathogenic factors, even weak ones. So we can see here, as the external pathogenic factors enter, If the coli is closed, it means there's no invasion. And if the coli is open, it means that excessive entering invasion of wind. If the coli is too close, excessive exiting fever from invasion of cold. This is the pathology of the entering and exiting of qi in the space between the skin and muscles. To summarize, pathology of entering and exiting of qi in the space between the skin and muscles. The space between the skin and muscles is part of the triple burner cavities called coli. The space between the skin and muscles is the exterior of the body. The defensive qi and sweat are in the space between the skin and muscles. Excessive exiting of qi makes the space between skin and muscles too tight. And lastly, the excessive entering of qi makes the space between the skin and muscles too open. Thank you for your attention.
Let's now discuss stomach 42, Chung Yang or rushing yang. This is located on the highest part of the dorsum of the foot, approximately 1.5 zoom distal to stomach 41, in a depression between the tendons of the extensor hallucis longus and the extensor digitorum muscles. Located over the pulsation of the dorsalis pedis artery, can also be located on the line drawn between stomach 41 and stomach 43, where the dorsalis pedis artery can be palpated. Stomach 42, Chung Yang, means rushing yang, meeting bones, meeting gush, unrestrained yang, meeting source. This is a source point and an exit point. As a yuan source point, stomach 42 will have the inbuilt stability and self-regulation that the connection with original qi affords. This chung quality of qi available at this point is frequently needed in the regulation of the stomach. This is shown by there being 3 points from stomach 30 downwards that include chung with its association of penetrative movement and rhythm in their name. In spite of the stomach's natural movement of descending the qi, it frequently gets caught going in circles, never stopping or going countercurrent. Getting out of rhythm and balance can mean the stomach cannot hold on to what it has received long enough to extract nourishment for itself or the other officials. It can mean that ideas are half-baked, not thought through, and experiences are insufficiently processed. Conversely, every impulse, idea, and instinct is done to death before ever taking shape because all the spontaneity and vitality has been thought about in every possible permutation, and everything just becomes another source of concern and exhaustion. Reconnecting with one's original chi can help one stop trying to control everything from anxiety and allow a moment of relaxation and trust in the universe, helping the stomach to truly receive throughout the body, mind, and spirit. Stomach 42 calms the mind and is used for emotional distress. When worry or overthinking is distressing a person, this point roots them back to a stable place. It can be combined with triple heater 4 for a harmonizing effect or Li4 for a calming one where there is chronic restlessness of mind or body. It tonifies stomach and spleen. As the source point, this point strengthens stomach and spleen. A good tonic point. Combined with TH4, it tonifies the middle jaw, dispels cold from the joints, and is used where there is obstruction from cold. Removes obstruction from the channel, and as the exit point brings chi downward and releases it, so it can be used to clear heat from the stomach and the yang ming. Chung in the point name means rushing, reminding one of the pulse that can be felt here and the chi at this point, which shares the surging, penetrative quality of Chung Mai. Indications: anxiety calms the mind and spirit, stabilizes stomach, a good tonic point, fever, hysteria, toothache, gingivitis, facial swelling, abdominal distension. Stomach 42 is known as the perfect calm point. This frequently used point can calm the system if there is worry, anxiety, mania, overthinking, or instability troubling the patient. It can be combined with TH4 for general harmonization of the system or with Li4 to augment this calming effect. Conversely, it can be used to invigorate the whole meridian. Potential point combinations. We can use stomach 42 together with Li11 and stomach 9 for hypertension. For migraine prophylaxis, we combine stomach 42 with stomach 36, LI6, and stomach 8 for headache along the LI and ST lines of the head. Evidence-based applications, migraine prophylaxis, though not as effective as TH5, GB34, GB40, and GB20, stomach 8, LI6, stomach 36, and stomach 42 offered minor benefits for migraine prophylaxis. Thank you for listening.
Let's now go through large intestine patterns. Let's discuss obstructing large intestine. So this concept is due to when both dry and heat pathogens and the stool combine internally and result in blockage of the large intestine, and this pattern manifests as an interior excessive heat pattern. It is classified into Yang Fu excess pattern using the 6 channels pattern, differentiation, the chi level pattern using the way, the chi, yin, and blood pattern differentiation, and the middle jiao pattern using the san jiao pattern differentiation. For clinical manifestations, there would be high fever or late afternoon fever, distension, fullness, hardness, and pain of the abdomen or around the umbilicus, which is aggravated by pressure, constipation or foul smelling stools, sweating, thirst or mania, coma and delirium, scanty dark urine, red tongue with thick and yellow coating or thorny tongue, and a powerful, deep, and rapid pulse. For analysis, this pattern is caused by an exuberant heat pathogen and excessive sweating, or by incorrect treatment with medicinals to induce sweating, all of which leads to an excessive dry heat pathogen, which binds with stool and blocks the intestinal tract. The key symptoms would be distension, fullness, rigidity, and pain in the abdomen, constipation with an interior excess heat pattern. We can see here the analysis of heat obstructing the large intestine. So if there's heat, when the heat stagnates in the large intestine, it will injure the fluids and it will fail to moisten and nourish the intestines, result in a heat pathogen and dry stool binding internally. So when the food chi is constrained and stagnated, there would be a manifestation of constipation, distension, fullness, rigidity, and pain of the abdomen or around the umbilicus, which is aggravated by pressure. When chi in the Yangming channel is vigorous in the late afternoon, there would be a late afternoon fever. When the dry stool accumulates inside, dryness and the heat push the fluids downward, there would be a manifestation of a decline of watery fluids and fecal impaction. When heat pathogen and stool binding and blocking in the intestinal tract and disturbing the mind, there would be a coma and delirium. When exuberant interior heat steams to drive fluids outward, there would be high fever, sweating, thirst, scanty dark urine. When the heat pathogen and stool binding internally, there would be a manifestation of red tongue with yellow coating or thorny tongue, a powerful, deep, and rapid pulse. To summarize, the etiology, excessive consumption of heating and or drying foods, externally contracted febrile disease, manifesting as Yang Ming pattern, also known as disease in the Qi aspect, possible stomach heat underlying. The signs and symptoms would be constipation with dry stools, abdominal pain with dislike of pressure, a burning sensation in the mouth, dry tongue, burning and swelling of the anus, and a scanty dark urine. The pulse would be full and rapid. The tongue would be thick, yellow, dry coat. For treatment principle, we clear heat and free the stool. For acupuncture treatment, we can use the points stomach 25, which regulates the intestine, Li11 clears heat, stomach 44 harmonizes the intestines and clears heat, kidney 6 supplements skin, promotes fluids, bladder 25 moves large intestine chi, stomach 37 regulates intestine and clears heat, Li2 clears heat, and we use the needle with drainage. The relevant advice: if there is heat in the large intestine, the patient should avoid consuming food and beverages that are hot in their energy. Spinach, bean sprouts, bananas, cucumber, fig, rhubarb, and bamboo shoots all drain heat from the large intestine and are therefore beneficial. Spinach is usually salutary because it moistens and lubricates the large intestine. This will enable the stool to move more easily through the large intestine. Thank you for your attention.
Let's now go to diagnosis by visceral organs. We discuss spleen illnesses. Deficiency of spleen qi impairs digestion and transportation of nutrients. As a result, nutritive qi becomes deficient and water and dampness are retained. An insufficient spleen cannot govern blood. These are the characteristic spleen illnesses. Deficiency of spleen qi. Deficiency of spleen qi results mainly from improper diet, excessive brooding or fatigue, or chronic illness injuring the spleen. As spleen qi declines, so does the spleen's function of transportation, and this in turn leads to impaired digestion. With inadequate delivery of nutrients, qi and blood cannot be adequately generated. In severe cases, there is retention of water and accumulation of dampness. The main symptoms of spleen qi deficiency are anorexia, loose feces, epigastric distension following eating, sallow complexion, lassitude with weariness, shallow respiration with reluctance to speak, and emaciation or edema. The tongue is pale with white coating. Pulse is even but feeble. Spleen yang deficiency is mainly due to progression from deficiency of spleen qi extending to spleen yang or to overindulgence of cold foods and drink, so that endogenous cold develops and injures the spleen. As spleen yang declines, it loses its ability to warm and to activate transportation and transformation. In these circumstances, endogenous cold arises, and in cold becomes strong in the interior. These processes manifest as deficiency cold of the spleen. The main symptoms of spleen yang deficiency are reduced appetite, distension, and vague pain in the abdomen, with preference for warmth and pressure, loose feces and cold limbs with cold aversion or edema of the limbs. Women may have increased menses that are thin and white. The tongue is pale and plump with white coating. Pulse is deep, thread-like, and forceless. Sinking of middle qi is the condition in which deficient spleen qi is unable to rise but sinks instead. Sinking of middle qi is mainly due to one of three following processes. Deficiency of spleen qi may worsen and progress. Persistent diarrhea or dysentery may injure spleen qi. Similarly, chronic exhaustion from physical labor also may injure spleen qi. The main function of spleen qi is to control ascent. If it is too weak to rise, then pure qi may sink and cause ptosis or prolapse of visceral organs. The characteristic manifestation of the sinking of middle qi includes sagging of the epigastric abdomen that is worsened after eating, persistent diarrhea or dysentery, and prolapse of the rectum or uterus. Additional symptoms include dizziness, blurred vision, weariness, weakness, and shortness of breath with reluctance to speak. The tongue is pale with white coating. The pulse is feeble. Thank you for your attention.
Let's now go to advanced assessment of mental health disorders. Let's discuss family history. Many mental health disorders are related to genetics. The healthcare provider should ask the patient about a family history of mental health disorders. Patients with mental health disorder often have family members who have experienced the same similar disorders. As an example, here, Miss D mother died of cancer about 6 months ago, but she believes she is over the death because of her return to school following the death. Her father has no known medical or psychiatric problems. She is the oldest of three sisters. Both her sisters are alive and well. Her paternal grandmother was treated for change of life depression, and her maternal grandfather was a secret behind the barn drinker. Next, assessing for violence. The healthcare provider should assess patients for signs of abuse and neglect perpetrated by one person in a relationship attempting to control or hurt the other. Such patterns are found across socioeconomic, ethnic, gender, and age groups and consist of domestic violence, sexual abuse, or coercion against elderly adults, teens, children, or intimate partners. Abuse also includes neglect, consisting of physical deprivation of care or emotional failure to provide verbal and behavioral expressions of love. Caring, empathetic questions by practitioners may open the door for later disclosure by the patient. Sensitivity to the patient's answers to questions about abuse is essential, and talking face to face is more effective than written patient questionnaires. The clear message should be communicated that the patient is not alone, is not to blame, does not deserve violent treatment, and that help is available. Following are some potential questions, modified from Campbell and Humphreys, to identify and evaluate domestic abuse. First, since our last visit during the past year or during pregnancy, have you been hit, slapped, kicked, or otherwise physically hurt by someone? If yes, by whom? The number of times and the description. Next, ask is, have you ever been emotionally or physically abused by someone close to you? Within the past year, has anyone made you do something sexual that you did not want to do? If yes, who? Next is, are you afraid of your partner or anyone else? In addition to physical signs of abuse, the advanced practice clinician should be sensitive to emotional or verbal clues to abuse, such as the following: wearing out of season clothing, family who will not allow patients to speak with practitioner alone, victim sits in a position that suggests fear or discomfort, sleep disturbances, attempt to avoid a particular person, fear of being alone or going home, recent weight change, passive or overly pleasing behaviors, post-traumatic stress behaviors such as hyperarousal, startle reflex, nightmares, and numbness to emotions. Other signs of anxiety or depression, drug abuse, or eating disorders from DSM-IVTR. The following elements of the SAFE acronym will also guide the assessment of domestic abuse and risk of danger. S is for stress in relationship. Is it safe with your partner? A is for what happens when your partner is angry. Are you afraid at times? Have you been abused? F is for what financial resources do you need? Is a firearm present at home? What do friends and family know of your situation? E is for emergency situation now. What emergency plan for escape do you have if necessary? Domestic abuse is one of the most common causes of complications during pregnancy. 1 in 4 pregnant women is physically abused, and the rate is higher when the female is a teenager. Be sensitive and alert to this domestic abuse and ask questions regardless of the setting or the reason for the healthcare visit. The age of living relatives include relationship and health of parents, siblings, and children. If there are deaths, ask about relationship of disease to patient and cause of death, specifically explore disorders that may have mental health implications. There's chronic diseases, neurological or mental health disorders. Ask about chronic diseases and mental health disorders. Is there a history of mental health disorders in the family? If so, what is the relationship of the family member with the mental health disorder? What disorder did he have? Specifically, explore the patient's family history of depression, dementia, panic disorders, obsessive compulsive disorder, and schizophrenia, as these tend to run in the families. Thank you for your attention.
Let's discuss acupuncture for emergencies. This time we talk about acute wrist pain. Acute wrist pain can result from various causes, including injuries, repetitive strain, or underlying medical conditions. Common causes are for injuries, sprains, fractures, or tendon injuries often lead to sudden pain. Repetitive strain, activities like typing or sports can cause inflammation. Conditions like arthritis, carpal tunnel syndrome, or tendinitis may also contribute. Symptoms: sharp or throbbing pain, swelling or bruising, limited range of motion, numbness or tingling in cases like carpal tunnel syndrome. So let's use the following points. You use acupuncture on kidney 3, Sanjiao 5. Use acupuncture on the hand's low back pain points, 2 points on the back of the hand. Use PC7, needle tip towards the middle finger, plus the following points. Lung 8 and lung 6 if there is numbness in the thumb, Li5 and Li4 if there is numbness in the point finger, PC6 penetrating to Sanjiao 5 if there is, and Zhongbai and Qiabai if there is numbness in the middle finger, Sanjiao 3 and Du 15 if there is swelling and redness on the back of the hand, Heart 7 and Spleen 6 if there is poor sleep, or Lung 10 if there is a muscle withered in the thumb. Use SI3 penetrating to PC8 for hand numbness. Use also Bashi point for finger pain and numbness, and SI6. Thank you for your attention.
Let's now go to fibromyalgia. Let's discuss regional acupuncture treatments for upper back. The main channels involved in fibromyalgia pain in the upper back are the small intestine and triple burner. The muscles underlying the muscle channels of the small intestine and triple burner channels in the upper back and neck are as follows. So here, the points of the upper back for fibromyalgia. The triple burner meridian, we use the triple burner 15. For the small intestine meridian, we use SI13 and SI11. The regional acupuncture treatment. For upper back, the small intestine, the superficial, the trapezius, teres minor, infraspinatus, supraspinatus. For deep, it's teres major. For triple burner, for superficial, it's trapezius, rhomboids, lavator scapulae, splenius capitis. For deep, it's infraspinatus. The strategic points to use are SI11 or Tianzong. This point is nearly always extremely tender on palpation, and if it is, it should be needle with moxa on the needle. The SI13 or the true one, this point is also nearly always very tender on pressure. It is a good point also because it is general point for painful obstruction syndrome. The last is the triple burner 15 or the Tian Liao. Thank you for your attention.